So, guys, so who would like to perform a role play with me? I'll be your patient and you'll be my nurse. So don't be shy. I know on the first go it could be difficult sometimes, but don't worry. Um, I'm here to correct you. So who would like to perform with me? Any one of you would be interested? Okay, so Mr. Rafiq, who would like to perform? You're most welcome. I'm gonna show you a role play card. This is the role play card that you're going to perform. So I'm gonna take a picture of my part. This is my part. Okay, so this is your part. When you're ready, just let me know then. Read it for 3 minutes, and when you're ready, just let me know.
Okay. Yes, sir.
You ready?
Yes, sir.
Okay, so you may start now.
Yes, sir.
Okay, you can start.
Hello, good evening, sir.
Good evening.
I'm a nurse. I'm Mohammed Rafiq. Yes, sir.
Yeah, go ahead. Just start how you would start with your patient. So consider me as your patient and start your introduction and do this role play. So if you make any mistake, don't worry, I'm here to correct.
Okay. Okay, sir. Hello, good evenings. I'm Mohammed Rafiq. Uh, uh, as a nurse is present in front of you. How can I help you today? Please ensure me your name and age.
Well, nurse, my name is Ali and I'm 34 years old.
Okay, thank you. Thank you for informing me. Okay, today the doctor is seeing you and they plan to discharge from hospital. Uh, uh, are you ready to going to home on the support of friend and regularly base friend and family on regular base?
Well, nurse, I don't want to be discharged because I'm not ready for that.
Okay. Uh, if you want to discharge, that to be better for you, because the hospital environment and home environment is different and healthy for you in home environment. If you want to discharge, then we plan your discharge summary.
Well, nurse, but I don't want to be discharged. I don't want to go home because my home is not really good, and I don't have enough support at home.
Okay, okay, okay. Uh, okay, then we providing you a care about your surgery and hip replacement. Need to physiotherapy provide uh, educated about it to provide physiotherapists. Uh, can you ready for this?
Oh, well, nurse, I because I don't want. I cannot walk by myself. I cannot walk independently, so I don't want to fall at home. So that could be a problem for me.
Okay. I suggest you, and your doctor already suggested that you will be better to go to home on the support your family and friend on regularly basis. Uh, this way is better for you, I think. Uh, 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 are you ready for this?
Well, okay, nurse. So, how will my medication will be given to me? I don't know.
Yes, I explained about your medication and other healthy healthy session provide healthy environment for you. Mm, explain that pharmacists deliver medication on daily basis as per your discharge summary. Don't worry and don't hesitate about it. It will be safe for you, inshallah.
Okay, and what about my wound?
Uh,
Will somebody come for dressing my wound?
yes, 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 we provided you a dresser who daily basis change your dressing, and physiotherapists provide you a physiotherapist uh, uh, who given physiotherapy as per given summary order, and already provide medication who given on timely. uh, you will be it is safe for you.
Okay, nurse. Thank you. So I'll try my best to follow
Yes,
your advice.
yes, okay. Uh, okay, okay. After that, I explain about your appointment to see your GP clinic uh, and uh, for assessment your wound and dressing. Uh, yes,
Okay, nurse. Okay, thank you for that.
yes. Okay. No, if you have any query related, uh, can't be hesitate. Will be contact me on the this number of my hospital ward.
Okay, thank you so much.
Okay, you are welcome.
Okay, so are you finished?
Okay, thank you, sir.
So, was was it your first time?
Yes, sir.
Okay, you performed well. Honestly, it's always very difficult on the first go. People can't even finish it on the first time. Some people give up in the middle, but obviously when it is your first time, you will make a lot of mistakes. and you
Yes,
need
sir.
to learn from that as well. So in this role play, when you started your introduction, it was good,
Okay.
but there were some grammatical mistakes, or I would say the, there were a little bit of mistakes in your introduction. You said I'm the
Okay.
you said I am the nurse in front of you. So you don't need to say you don't need to say that I'm in front of you, because that doesn't
Okay.
that is not required, because the patient already knows
Okay.
you are in front of your patient, right? So
Okay, sir.
what you can do is you can start by saying, "Hello, good morning. My name is Rafiq. I am one of the nurses today at this hospital in this surgical ward. Um, may I know your full name and age, please?"
Ma'am.
Uh, so instead of asking, "May I know your full name and age, please?" you said, "Can you ensure me your name and age, please?" which was a grammatical mistake. So try not to do it.
Okay.
Instead, you can just say, "May I know your full name and age, please?" So when your patient tell you
Okay.
about their name, then you can say, "Thank you for the information," which you did. That was really good. You said, "Thank you for the information." Um, so after that, you told your patient that you
Mm.
are going to go home today. The doctor has advised that. So, uh, how would be your patient, your first question to your patient in this situation? Then you can say, "Well, I have some good news for you that you are going to go home today, as your doctor has advised. But if you have any question prior to discharge, I'm here to discuss with you." So
Okay.
then your patient will say, "Well, nurse, I don't want to go home because my family does not know how to take care of me, um, and I don't want to be at home." Then you can say, "Well, then you can say, how will you start?" You don't need to say yes or no, this or that. You can just say, "Well, I totally understand your concern. Is there any other concern that you would like to tell me why you don't want to go home, apart from that your family does not know how to take care of you?" Then your patient will,
Okay.
if you look at task number 2, it says, "Ask if the patient has any other concerns about going home." It means the patient already has concerns about their family, but ask them if they have any more concerns. So then you can say, "Apart from the concern that your family does not know how to take care of you, do you have any other concern?" Then your parent will tell you what concerns they have. So what you need to do in that situation is you can say, "Well, thank you, Mr. Ali, for giving me all the information and sharing your concerns with me. Let me tell you." Then you can explain to your patient that we will arrange
Okay.
then you can tell your parent that a physiotherapist will be arranged from the hospital who will educate your family about your mobility and how to take care of you. So
Yes, sir.
once you say this to your patient, then you can ask this question. You can say, "How does that sound to you?" Always ask this to your patient so that they can then respond to you. Your patient may say, well, whatever they say according to their role play card. They may say, "Well, nurse, I got that, but what about my medication, as I asked you?" Then you can say, "Well, that is a very good question." Always encourage your patient. When they ask you a question, always encourage them. You can say, "That is a very good question. Let me tell you that pharmacist will deliver your medication before the discharge, so you don't need to worry about your medication."
Okay.
So after this, you can say, when you explain this to your patient, you can say, "Am I clear to you so far, Mr. Ali?" This is how you will ask your patient. Then your patient will say, "Yes, nurse, you are clear, but what about my wound and the dressing?" Then you can explain
Yes.
the next one. You can say, "Explain that the patient will need to make an appointment to see the GP who will check his her wound and reinforce the dressing if necessary." You can say, you can reply like this. You can say, "Thank you, Mr. Ali, for asking me this question. Let me tell you, you would I would suggest you to make an appointment with your GP your GP will look at your wound, and if necessary, he or she, you can say your GP will advise redressing for your wound. Is it clear for you?
Okay, that is fine. Yes, sir, it is clear for me.
So, and at the end, you can say, Mr. Ali, let me tell you, if you have any issue, any pain you face, please don't hesitate to contact the hospital. We are here to help you. Uh, and please take your medication on time for the pain. And if you still have any problem, please don't forget to call us. And it's given bleeding side or any elevated temperature. You can say if you experience any bleeding from the wound, or if you think you have temperature that does not relieve with the medication, please contact the hospital emergency number.
Okay, sir, done.
So when you are done with all these tasks, then it is time for closing. So how will you do closing? You can say, Mr. Ali, do you have any other question that you would like to ask me? As you asked me, that was the right thing. So I told you, no, nurse, everything is clear. So then you can say, thank you, Mr. Ali, for your time. If you have any other concern, please don't forget to call us. Here is the hospital contact number, and I wish you a speedy recovery.
Okay.
So that is how the role plays are done, and that is how you should do it. I know with time you will learn. Just stick to it, how to perform it, how to use different sentences, and how to be polite towards your patient, and how to be soft.
Yes, sir.
Any question?
No, sir. I have cleared a lot of mistake from here. Inshallah, we will be better next
Yes,
uh, role play. Inshallah.
yes, you will be. So just focus on these minor mistakes. You'll be good.
Okay. Thank you, sir.
No problem. So, do you have any other participant who would like to perform? One of the persons said in the comment section. So, if you would like to perform, just let me know.
Miss Anila, please speak.
Sorry, your voice is not clear. Can you say that again, please?
Miss Anila wants to speak.
I don't know. Your voice is not very clear. I can't really hear you. Maybe you need to mute and unmute. Probably that will clear.
Sir, are you listening?
I mean, there is kind of noise in from your side, so I don't know what makes it. But okay, one of the person from the chat section wants to perform this one. If you need time to prepare, just let me know. If not, we can start the same role play card right away, because if you perform the same one, it will make it clear for the rest of the listeners as well, and it will be a little bit easy for you as well.
Sir, I think there is some net issue.
I don't know if you're saying about your hospital, but I'm not sure, but your voice is not clear.
Sir, Sir, I think there is some.
I'm sorry, it was too noisy, so that is why I muted you for a minute. I don't know if your voice will clear up. So that is pretty much it for now. If you guys have any question, any suggestion, any recommendation, you can give me that, and you can also message me personally. I will appreciate your suggestions. I think this is time for us to end the session. If you have any question, any suggestion, you can ask me now. We have just a few minutes left.
Sir, please tell me the reading criteria for the beginners.
The reading criteria. So I think we can arrange a next session, a session next time. So I will tell you about the reading criteria, we'll go through it completely. So for now, we don't have much time to go into the detail of that. But if you just want the criteria, that is, the criteria is if you want to pass your reading, you need to answer at least 30 correct ones. So out of 42, 30 should be correct. So that is how you will get 350. That is B grade. But we'll discuss about detail in our next session about reading.
Sir, I am not good at grammar. Sir, how far there is a role of grammar, basic grammar?
In reading or in listening? Sorry, in speaking. Are you talking about grammar in speaking? Obviously, in reading, you don't need grammar because you just need to, you know, encircle the correct answers, or shade the circles. And in speaking, obviously, your grammar should be. Nobody has perfect grammar, but it should be good enough at least, so that your patient does not get confused. So, and your grammar, I can say from your speaking, your grammar is not that bad. You just need some practice and some guidance. So the more you practice, you'll be okay.
Sir, how we can underline our role play?
Well, this role play card will be given to you. It's right in front of you in paper form. So
Yes.
if you want, they will give you a pen and a paper as well. So you can just underline the tasks if you want.
Okay.
Yeah. So and they will give you a blank paper as well. If you want to write something on it, you can do that as well. Any other question?
No, sir, everything is clear.
I think there's another person who wants to speak.
Thank you. No,
So we don't have much time left in this session. We're going to end this. And if you have any problem, you can just message me on WhatsApp. And I'll see you guys in next session, hopefully. So it's a goodbye for now. So practice regularly, and I'll see you in your next session.